We're wasting much time. We'll start off with the presentation so that we can take the questions later on.
I would request everyone to be on mute for now. Good evening.
What are you looking for? I know.
Yeah, ma'am.
Okay.
Yeah.
So I think many people wouldn't exactly be aware of what a stroke means. Many people still confuse it with a cardiac event. But how we say as a heart attack, we can call stroke as a brain attack. Right. So initially we start off with what the question, what is stroke? Like I told in layman terms, we can call it as a brain attack. So like our brain, like any other organ in the body, requires oxygen, which it gets through the blood supply. So whenever this blood supply is cut off, either because of a blood clot in these blood tubes, or because of the rupture of the blood tubes, that part of the brain is damaged. Okay, and the symptoms which occur due to that is called as stroke. So, okay, fine. Now, the types of stroke. So there are two common types of stroke. One is ischemic stroke and hemorrhagic stroke. So when we say ischemic stroke, it means that these red tubes, as we see, are few of the blood vessels in our brain. So whenever there is a clot which deposits there, like this, what we're seeing here, so that part of the brain will not get the blood supply, and then it gets damaged. All right. And when we see a hemorrhagic stroke, then this blood tube ruptures or bursts, and there's a leakage of blood into the brain tissue. So that is then. So now we know what is ischemic stroke and what is hemorrhagic stroke. Right, so this is another picture depicting that. So there's a blood clot blocking the tube, causing ischemic stroke, and a rupture causing hemorrhagic stroke. The ischemic stroke is the more common type of stroke among these, and this is a CT brain picture, which shows how an ischemic stroke looks on the CT and how an hemorrhagic stroke looks on the CT brain. Okay. Now, there's another thing which we should know about, which is called as transient ischemic attack, or a TIA. In simple words, we can call it as a mini stroke. Now, what is a mini stroke? It means that transiently, the patient may have some symptoms, let's say numbness, slurring of speech, which recovers in a few minutes or hours, and then that patient is completely normal. So, and many people ignore this. They think, okay, maybe I was just tired or something. But this is a serious warning sign that there may be a future stroke. So a TIA, a mini stroke, has to be taken as seriously as a stroke. Now, the next important question is, how do we recognize that a person might be having stroke? So there's a very simple mnemonic for the general public called as FAST. Okay, that means act fast, where F stands for face drooping. So suddenly we see that the person's one side of the face is drooping, or when they are talking or smiling, there's a tilting of the face to mouth to one side. And A stands for arm weakness. So one arm is weak or numb. So the person is not able to lift his arm. And S stands for speech disturbances. So suddenly, the person is having the difficulty in understanding speech, or he's not able to find the words, or the speech is slurred. So these are the very common symptoms of stroke. And T means if you recognize this, it's time to ask for help, take the patient to the hospital, or call the doctor immediately. Now, these are the common symptoms. Now, apart from these also, there are some symptoms which you should be aware about. So headache, loss of consciousness, behavioral disturbances, vomitings, fits, and numbness on one side of the face or the body, difficulty in swallowing, and gait imbalance, confusion, giddiness is a very common symptom of stroke. So these are the various symptoms which everyone should be aware of. Right? So these are all the effects. Now coming to what causes stroke. So why does a stroke occur? So when you say the ischemic stroke, the most important cause is something called as atherosclerosis. Now, atherosclerosis, you can see in this blood tube, there's some yellowish deposit. So that is the cholesterol deposition in the blood tube. So over the years, there is a cholesterol deposition in the blood tube, and that is called as atherosclerosis. Now, when this significantly increases, and due to some reason, if there's a rupture or a break in this plaque, a blood clot forms and sits there, and it may either block this tube or a blood clot may be taken to the brain and then block a tube there. Atherosclerosis is one of the commonest causes. Apart from this, patients having cardiac diseases, very commonly atrial fibrillation, which is a problem with the heart's rhythm. The heart is not beating regularly, and there is a tendency for formation of blood clot in the heart, and that clot can be dislodged to the brain. And other valvular diseases, all these cardiac conditions. Then there are some blood conditions, like if the blood clotting tendency is more, like the blood tends to become more sticky and clots, various coagulation disorders like sickle cell anemia and other coagulopathies. So all these causes. Now, apart from this, there are what we say as a risk factor for stroke. What are the risk factors for stroke? In the sense that if you have any of these risk factors, then you have a more chance of having stroke. The most common is high blood pressure. Uncontrolled blood pressure is a very important risk factor for stroke. And then there is diabetes, right? Uncontrolled diabetes is a very common risk factor for stroke. Heart diseases, like we discussed, and one non-modifiable risk factor is age, advancing age. And then if there's a family history of stroke, and then the lifestyle factors are there, like sedentary lifestyle, excessive alcohol, and smoking is a risk factor because it tends to increase the blood clotting tendency. Then if there is a previous history of strokes or PIAs, then again, there's an increased risk of stroke. And then obesity, unhealthy eating habits, oral contraception, and medication. Some medications are known to increase the chances of stroke. So these are all the various risk factors for stroke. So like we discussed, what could be the chances that you are at risk for stroke? If there is atrial fibrillation, hypertension, cardiac disease, no exercise, diabetes, smoking, heavy alcohol use. All these things which we discussed: medications, obesity, stress, heart disease, diabetes, physical inactivity, high blood pressure, excessive alcohol consumption, high blood cholesterol, and smoking. Right. So, so far we have discussed about what is stroke, what are the types of stroke, what causes stroke, and what are the risk factors for stroke. Now, Dr. Keni will brief us about the management of stroke and the prevention.
Good morning, everyone. I'll be covering about the stroke prevention and management. So one good thing is that strokes can be prevented up to 80%. Yeah, so the best treatment for stroke is prevention. The risk for this can be reduced by following two important measures. First of all, maintaining a healthy lifestyle. And second thing is controlling the risk factors which can predispose to stroke. So the lifestyle measures, which basically consist of consuming a balanced diet, avoiding stress, reducing the weight, keeping a weight under control, exercising regularly, drinking plenty of water to maintain adequate hydration, and getting enough sleep. So this constitutes a healthy living. By doing this, the risk of stroke is reduced. And apart from that, if patient has risk factors like hypertension, diabetes, this should be controlled. So healthy diet comprises basically eating plenty of fruits and vegetables, eating high fiber diet, and limiting the use of certain sweetened drinks and refined carbohydrate like maida-based products and added sugars, and trying to avoid junk foods like French fries, nuggets, pizzas, burger, etc. So because all this what this food have is basically they contain a lot of calories and they have added sugar in the diet, which is unhealthy. So like for example, a can of soft drink contains about 40 grams, that is about 10 teaspoons of free sugar. Ketchup has a lot of salt and also about 1 teaspoon of sugar. So this is the reason, because these are in the long term they can predispose to stroke by causing atherosclerosis. So these junk foods and soft drinks should be avoided. So physical activity is best, like as you all do. Best is to at least walk for about 150 minutes of moderate intensity exercises. And children also should be encouraged, and teens should be encouraged to at least get 1 hour of physical activity every day. Our weight should be kept under control regularly by doing exercise and by consuming a healthy diet. And we can check the body mass index, which gives an idea regarding whether it's either you are overweight or obese or you are in the appropriate range. And smoking is one of the important risk factors which can be avoided. And smoking should be, if a person is smoking, he should be encouraged to quit smoking. And same way, who is not smoking, he should be discouraged for taking up it later. Blood pressure should be regularly checked because this is one of the silent killers. And unless you check regularly, we never know that who has blood pressure. So that's important that once you patient about 40 years and above, they check the blood pressure at least every 3 months, 6 months. They check the blood pressure regularly, and similarly, sugar should be checked annually, because the similar diabetes also goes sometimes undetected. So some symptoms like excessive thirst, urination, increased hunger, these are warning signs that potential diabetes may be there. So you should go to the lab and check the sugars monitored. And apart from that, cholesterol is another killer which is there. So cholesterol levels also should periodically monitored at least 6 months to 1 year after about 40 years onwards. So next comes the stroke management. So most important thing is that stroke is the emergency and each second counts. So with each passing second or each passing minute, more and more of the brain cells get damaged. And once that time crosses the important time frame of the important first 3 hours, which we call the golden hour in stroke, during that time, if it's not there, the brain damage can be irreversible. So it is important that the moment the symptoms, what Sowmya said, like that fast symptoms are there, you should act fast and be in the hospital within the first 60 minutes of the stroke onset, so that diagnosis can be confirmed and treatment can be given. So first and foremost, when the patient comes to emergency room, we confirm diagnosis by doing a basic scan like CT scan, by which we can get an idea regarding the patient has a clotting in the brain or any blood tube is burst in the brain. So if there's a clotting in the brain, the important drug which is available, the patient reaches within the first 3 hours and up to 4.5 hours certain patients. So it is a clot buster. So this we give an injection known as the TPA, which stands for a tissue plasminogen activator. So this is how it acts. We give it in one of the veins, and it goes through a circulation and goes to the side of the blood clot, and it helps in dissolving the clot, thereby restoring the blood supply. So, but important here is that it's beneficial when only we given within the first 4.5 hours. Best result is seen when it's given early within first 3 hours. So that's the reason the patient should be brought to the hospital at the earliest when symptoms start. In certain patients, there are certain procedures which can be given. These are basically the endovascular procedures. These can be used both for hemorrhagic stroke and for ischemic stroke. So what they do is they put a device in one of the vessels of in the periphery, and through which they go to the carotid artery in the neck. And then if there's a clot, it can retrude out. Or if there's a bleeding or the tube is weak or bulging, they can put a mesh there to prevent the bleeding from occurring. And sometimes patients which have a bleeding in the brain, they need surgery as a life-saving procedure. So these are best done. These also are best done and done early. The later the intervention, the chance of the brain being repaired is less. So these are the main constitution of the acute stroke. So next important thing is that post-stroke recovery after discharge from the hospital. So when a stroke happens, the weakness and the speech difficulty is just the tip of the iceberg. There are other aspects which happen in that. So commonest being paralysis and speech problem, as I told you. But apart from that, patients can affect the thinking, it can affect the emotions, it can affect the chewing and swallowing, and it can also affect their ability to control the bladder and bowel. So for rehabilitation, it is a comprehensive thing which needs the proper teamwork. Mainly the caregiver is the first and foremost person who is more important. But along with that, they need therapists on a regular basis, mainly at the aim of ability to maintain the gait, balance, and mobilization. improving the upper limb function by doing some exercises, simple exercises like giving a squash ball or some sponge ball to squeeze, and improving the cognition by reinforcing the memory. And visual and speech issues can be there, so they should be reinforced by giving some speech therapy, etc. And nutrition and swallowing problem encounter, so it is important that they are taken care like how we treat children, because swallowing and all reflex can be lost after stroke. So this predisposes them to risk of aspiration and pneumonia. So it is important that the caregivers are taught about safe feeding. And one important aspect is that the people who are especially have major stroke and are bedbound, they can have bed sores. So for that reason, we should use certain special mattresses which are available, which basically prevent the injury in the gluteal region from occurring. So the general rehabilitation comprises of all these things, and secondary prevention comprises reducing the risk of infection. So because patients who have stroke, they can have certain infections like mainly urinary infections or sometimes even aspiration pneumonia. So these are best taken care by following the practices which are recommended in hospital. And one more thing is that which can happen is after stroke, there can sometimes be something like venous thromboembolism, where there can be clotting formation in the patient's legs where they are chronically bedbound. So for that reason, they should be sometimes put on some anticoagulations to prevent this. And emotional well-being and mood change are very important because these are the factors which play an important role in the patient's recovery. So the most important therapies which are required is a speech therapy, which help the patient to regain the ability to speak, listen, write, and comprehend. Physical therapy mainly involves the fine motor skills like the hand functions and the gross motor like the power and the walking. And coordination skills are important in patients. Sometimes they may lose balance. So occupational therapist is a very important role. This is commonly ignored entity because these therapists are skilled at improving the patient's fine motor. And they teach the patients how to take care of the daily activities, eating, drinking, dressing, bathing, reading and writing, etc. So the factors which affect the outcome of stroke rehabilitation are first of all the physical factors. So the more severe the stroke, the longer time it taken to recovery. Emotional factors are very important because after stroke there can be depressed mood and there can be some psychiatric issues develop. So the motivation is very important. And adherence to rehabilitation is very important because stroke recovery takes a long time, which may vary from months to years together. So that's the reason they should be constantly motivated so that they adhere to therapy which is suggested. And the most important role is the support of family and friends because of the disability, the significant dependence is there. So without the support of the family and friends, the stroke rehabilitation is difficult. And therapeutic factor is most important. The earlier you start rehab, the earlier the recovery. So that's the reason we enforce that we start therapy at the earliest. As early as within 24 hours stroke onset, it's better to start the rehabilitation process. So as I told, this rehab should start at the earliest because the earlier you start rehabilitation, the more likely and the more briskly it is likely that patients can retain to their baseline. So for stroke rehabilitation, it's recommended that as early as within 24 to 48 hours, depending on the severity of stroke, the rehabilitation is started. So the tips for caregivers is that they should be aware of the patient medications and adverse effects because many patients are given blood thinners. So they can cause risk of bleeding. So that they simple activities like shaving, brushing the teeth, or even taking care of their catheter, which sometimes we have. Sometimes this can cause bleeding. So they should be aware that this can happen. And they should be informed the doctors regarding suppose they are going some procedures, a dental procedure, etc., that they are on this thinner so that they can adjust the dose accordingly. And for reducing the risk of recurrent stroke, ensure that the patient consumes a healthy diet, does the exercises regularly, and adheres medicines prescribed. And for patients who need sometimes get imbalance, they may ambulation, so they can provide walker or wheelchair, etc., so that they can be mobilized. And falls are very common after stroke. Sometimes the fall may be trivial, but sometimes it is serious. Has severe pain, bruising, or bleeding. Important that the patient is taken to hospital immediately and this secondary is taken care of. So is that we should monitor changes, evaluate whether load time to control emotion. But depression is very common after stroke and affect the patient's ability to recover. So it is
Sir, but the injection in the like ತುಂಬಾ ಇದಾಗತ್ತಾ like
they can get adjusted.
ಇಲ್ಲ sweating ಸ್ವಲ್ಪ
For
ಗಿಡ್ಡಿನ
other family members or friends, etc.
ಆಯ್ತು ನೀವು ಹಾಕೋದ್ರಲ್ಲ ಅದು ಟ್ಯಾಬ್ಲೆಟ್
So most important point is that after a stroke, there is a high chance of recurrence.
ಸ್ವಲ್ಪ ತಲೆಯಲ್ಲಿ
So for preventing the second stroke is more important. So these are the 8 habits which are there. So basically they are same as the one which were told earlier. So after a stroke, there's a as high as 50% chance of recurrent stroke. For that reason, to prevent this, patient should better slim down, get active. They should quit smoking, eat what is right and recommended, monitor related blood pressure, hypertension, cholesterol, diabetes, etc., and keep the blood pressure under control and manage medications regularly so they're taken on time, and also cut down on alcohol. So remember, the take-home message is that stroke is a medical emergency. We should know what symptoms of stroke are and act immediately. The best treatment of stroke is prevention. So we should ensure that we follow healthy lifestyle, control medications like medical conditions like BP, cholesterol, diabetes, etc. And the earlier the start the rehabilitation, the more the chance of recovery. And to prevent a second stroke, the risk factors control in adjunct medicines prescribed is important. So with this, we have finished the presentation. We'll be happy to take any questions.
Oh, yeah. We saw you.
Yes, I was traveling here.
Okay.
These are questions we have submitted.
We can just stop the slides, right?
Any questions in the chat?
Yeah, there are
Yeah,
four,
some chats we can take these ones.
Whichever you feel like. We start off with that.
Yeah, I think start off with that and then.
Yes, sure.
And if it's the same, just keep it here.
We'll paste these questions in the chat itself. It will be easier for you.
Which one?
These ones,
Okay.
we'll paste in chat itself so you can see.
Fine, fine, all right. So the first question is, may I know what is a blood clot? Okay.
It starts with this. Not sure, but I think stroke caused paralysis.
So see, a blood clot, our blood is constantly in motion, right? And then it has to be, has to be a smooth flow. Now, how this happens is one, because of the constant motion. Now, if the blood stops moving constantly, then there's chances of blood clotting. Like you might have seen when we draw the blood out, for when we take it for some blood test and we put in a container, it is going to clot. So that is one factor, the constant motion. The other things are there are a lot of, chemicals or substances in the blood which help to maintain a balance and maintain our blood in a fluid state. So what happens when because due to some reason, when there's an imbalance in these factors, then the blood, tends to harden. There is a lot of reaction which takes place, like platelet reaction, fibrin. All these form like a blood clot, and this, they can just block they cause obstruction of the blood tubes, right? So which is dangerous. So that is what a blood clot is.
Then again, the blood become thicker.
Sorry, you can please play chat. Place your questions on the chat box. What's the next question?
Problem with blood flow in the brain is done.
No, there are questions. What's the next question?
So which is done? This is done, right? With high
No,
intensity.
that they are just talking.
Okay, problem with blood flow to stop.
So blood clot we have explained. I hope people have understood. So I think Ravish, can a person have mild stroke and not be aware of it?
Mild stroke is like a patient has some symptoms like usually some numbness. Sometimes they can have sometimes just giddiness. Sometimes the speech can be just be little unclear. So these are the minor symptoms, and commonly this, as Dr. Sowmya told, that this can be part of something known as a TI, which stands for transient ischemic attack, and which get normal that themselves within as much as 24 hours, or sometimes even earlier than that. So these are commonly mistaken for just being unwell, and if these are not investigated, the patient can have a high risk of getting a major stroke. So if any symptoms, any patient above in the 40s and above, if they have symptoms like some like minor symptoms like some giddiness or some speech being unclear, or one part of the limb being slightly weak than before, or just feeling some imbalance, it's better you get consult a doctor at the earliest and get investigated to learn if the stroke is there.
Yeah. And what happens, many people we have seen, they, for example, they have a mild numbness in the hand. And, sometimes they just attribute it to, oh, maybe I just slept on this side, that's why it's become numb. Or maybe I'm tired, or maybe my sugar is down. So when the symptoms are mild, people generally try to find explanations for it and kind of ignore it. But sometimes these symptoms may go away, or sometimes this may be a sign that the stroke is going to increase. So it starts with numbness, that tomorrow you may have weakness, and then it may really become more severe. So even if it is a false alarm, I think you should immediately get in touch with your doctor. The next question.
After that, I think he's sent the questions. Should I just make this maximize this? It's easy for you.
Okay. So as runners, what are the basic tests required for your normal cardiovascular health? As one person is having normal basic vital and chronic illnesses, as of now, 7 tests of runners happening. Anyway, I think this question is more apt for the cardiologist. We are neurologists, but still, as physicians, we can answer this. I think if you're otherwise healthy and you don't have any health issues, there shouldn't be a problem. But if you're about 35, 40 years, I think you should have a yearly health checkup with your cardiologist, which would include the cardiologist evaluating your symptoms. What are your risk factors for having a heart disease? Some basic tests can be done, like an ECG, echo, and a treadmill test, I think. And then if there's any issue, the cardiologist should point it out to you. Next, how to prevent future repetitive strokes?
Yeah, so this one I think I've already covered. So the best way to prevent future stroke is that first and foremost is to adhere to medicines prescribed, be it blood thinners, medicine for blood pressure, diabetes, cholesterol. All these should be adhered strictly. And apart from that, the exercise is most important, diet is most important, and respect the prevention. Apart from that, like quitting smoking and cutting on alcohol. So these are the risk factors which can be prevented, and by taking medicine regularly and following the lifestyle measures advised and avoiding risk factors, then the risk of stroke can be prevented. And sometimes apart from that, sometimes there is a need for intervention. Like for example, if patient has some abnormality in the heart, some heartbeat being irregular, sometimes the blood tubes in one of the neck vessels being blocked, then they may need interventions in the heart or intervention in the neck to prevent a recurrent stroke. Like for example, like similar like cardiac, you must have angioplasty being done in the heart. Similarly, there can be some angioplasty or some revascularization procedures can be carried to prevent the risk of recurrent stroke.
Right. And the next question is, what immediate action to be taken if there's a stroke attack? So I think this is a very important question. So when you have a doubt that, okay, I may be having these stroke symptoms, or the person around you has some stroke symptoms, just do these checks like we told you about FAST. Check if there's a phase stroke, check if there's any arm weakness or numbness, check if the person is having any kind of speech disturbances or any other symptoms that we discussed with you just now. And then if you have a doubt, then immediately call the ambulance or take the patient as soon as possible to the hospital. That is what you need to do. Now, why this is important is because, like in cardiac attack, the time from the onset is very important, to administer the proper treatment. There is something called as golden hour, which Dr. Ravish did mention. So which is within 3 hours, maximum 4.5 hours. What we need to do here in case of an ischemic stroke, we need to take out that blood clot so that the whatever part of the brain which is not getting blood supply adequately at that moment, we can restore the blood supply and we can prevent further damage to the brain. So I think it is very important to be aware of this. So the golden hour is as soon as possible after the onset of stroke, the person needs to be taken to the hospital. Next question is, what should mileage be in a week so that our heart and lungs be more strong and fit?
So as such, it varies from person to person. There is no fixed mileage as such, but the recommended guidelines for the heart and brain and lung, it is recommended at 150 minutes at minimum per week. Rather than the kilometers is the minutes, which is important because the capacity varies from person to person. So you should ensure that in your cardiological whatever, you should do not overexert yourself. So if you are in the limits, you can slowly build up the mileage over time. So rather than the number of kilometers, it's the number of minutes it matters. So at least 1 to 2 minutes per week is important than the number of kilometers.
Yeah, so the next question is, after seeing many fit people passing away due to cardiac arrest, I have been contemplating whether to do long distance running. Since I'm also going through hypothyroidism with Hashimoto thyroiditis and adrenal issues, kindly give your suggestion. So yes, I think many people would be really stunned to hear these news about fit people, young people passing away. And then there's a tendency to imagine that, okay, you also are going to have the same thing. I don't think, we need to worry in that way. So we don't know what health conditions they had or what exactly led to that situation which happened. I think rather than generalizing that this may happen to everybody, I think we need to look at our own health condition. So if you're having some conditions like hypothyroidism and adrenal issues, you just have to be in regular follow-up with your doctor and make sure that all these conditions are treated and under control. And as I suggested, about 30-35 years, it's good to have a yearly health checkup. And of course, I think all of us should know what is the limits. Probably overdoing may be harmful. Otherwise, I think there's no reason to panic as such because of these things. What are the chances of one side of the Okay, can we take the next question? Late night work and lack of proper sleep next day morning for a workout is advisable or not? Yeah, so I think this is a very relevant question. Most of us are compromising on a good sleep these days. I think a good 7 to 8 hours of sleep is very essential for a healthy day or to maintain a good health. I think we should definitely not compromise on this. Next. You want to take it? Next.
Okay. Non-functional relations.
Yeah, there's something that one accident, my hand only, doctors advise the scan. One side of your brain is not functioning from birth. You want to take this?
Yeah, so I mean, I think the person who has asked the question, according to him, there was some problem at one side of the brain not functioning from birth. So this might be possible that when the time of birth, this is not like a brain stroke kind of thing, but this is related to probably some insult which happened round about time the person was born. So what happens is sometimes when during the time of birth, there can be some complications related to a labor or after the delivery of the child, where there can be some low sugar levels or lack of oxygen or other like an infection, etc., because of which a particular area of brain damaged. So usually our brain has two halves, left and right, and both are equally important, but the dominant hemisphere is the left side. But when there is a brain insult happening within the first year of life, there is something known as the plasticity, where the control shifts to the opposite side. So normally our brain has opposite control, but when there is a brain insult happening early in life, the other side of the brain compensates. So this is probably what might have happened in this case, but we definitely need to look at the details, like we need to examine him and see his the MRI, etc., to definitely comment further.
Yeah, I see a lot of questions about heart attacks. So I think many people are still not aware that a stroke is different from heart attack. So that is with the heart, right? And stroke is a brain attack. All right. So of course, what happens is that heart attack people know immediately. Like suddenly they have chest pain, sweating, breathing difficulty. They suddenly collapse, or some discomfort. At least people are aware that they have to be taken to the hospital immediately. Whereas in a brain stroke, very rarely it happens so dramatically, unless it is very severe, where the patient suddenly loses consciousness and falls down, or suddenly is not able to move one side of the body. That is when otherwise mild symptoms people commonly ignore. So I think heart attack is different, brain attack is different, stroke is a brain attack. Now, Lakshya says that for some milliseconds, sometimes I feel that my body suddenly loses sync. I lose control over body. I'm not sure how to define the situation. It may be like paralysis kind. It happens for a fraction of a second.
Yeah, so this kind of thing which happens for a fraction of a second, usually we see in people who commonly have anxiety, like who sort of like due to various reasons where you can be anxiety sometimes can be very severe to cause panic symptoms, wherein suddenly they feel that the body has lost sync. But nevertheless, if the person is above 40 years and all, if definitely they have the symptoms occurring repeatedly, it's always better to consult a neurologist and find out if there is really some neurological issue which may be there. And based on neurological assessment, they may suggest certain brain scans, etc., and blood test be done. So, but from the symptoms last only for a few seconds, milliseconds, usually it's not likely to be a stroke. Usually, the stroke symptoms last for at least a few seconds to a minute. Milliseconds are too less of time to say it's a stroke or anything.
Then there's another question: what are the chances of blood becoming thicker or harder? So, yeah, blood clotting tendency. So, one simple things like if you're dehydration, right? And then if you're consuming some medications which can cause the blood to clot easily, like commonly like oral contraceptives and a few other medications, or if you have a tendency in your blood which causes the blood to clot more easily, which are called as hypercoagulable states. Smoking is another cause where it increases the clotting tendency of the blood. So these are all the causes how the blood can clot. There's another question. Please share your view about cholesterol as there are many contraindications.
Yeah, so cholesterol is an important thing which is there in the bloodstream. We have two cholesterol. One is a good cholesterol and bad cholesterol. So the good cholesterol, which what we say is the HDL, and the bad cholesterol, which we say is the LDL. Which H stands for high density cholesterol and the L stands for low density cholesterol. So the high density cholesterol is important because it is required for transport of important brain, important certain vitamins, important nutrients, etc. And also it takes the plaques out from the heart and from the brain. So in the vessels, the HDL takes these plaques out. Well, the LDL is the one which is harmful. It causes the blood vessels to get damaged. It causes some oxidative stress to the blood vessels, and it can result in clotting. So that's the reason the diet is important. Like you should eat diet which is rich in HDL, like the fresh fruits, green leafy vegetables which contain antioxidants, and you should avoid the food stuff like which contain maida, artificial sweeteners like cold drinks, junk food, etc. So here is important. So cholesterol is required because it has good and bad things. So you should know the levels of that and you check it regularly by doing blood test.
More questions? Little finger gets numb or stiff, we should be concerned, and if so, how to take precautions? Little finger. There could be various reasons because of that. The numbness, if just a finger is getting numb, then I think it is more like a local nerve problem than a problem in the brain. Of course, the issue can also be in the cervical spine region. But I think if it is happening repetitively, you should consult the neurologist. Probably, they can evaluate, see what is the problem, do the appropriate tests, and give you the solution. Are there any extra danger for the child born with cerebral palsy?
So, I mean, they don't have a risk for stroke as such, but they can have other issues. Maybe they can have a developmental delay. They can have behavioral issues like they can have some hyperactivity, autistic traits, etc. And the main thing they can have is that they can have seizures. So they don't have a risk of stroke per se, but they can have other neurological issues which are informed.
Then she can take the next question. Yes. What is it? Seizures can be related to brain stroke. Can seizures lead to stroke?
Yeah, so seizures can be one of the many symptoms of stroke. So commonly we see patients who have something like embolic stroke, which is related to a clotting in the brain secondary to cardiac issue. So these strokes tend to have seizures at the onset, and some other strokes which can have seizures at the onset is something like hemorrhagic stroke, where the blood tubes rupture. So these are the common two strokes which can have at the onset of the stroke they can have seizures, and apart from that, other strokes like venous strokes where the veins of the brain can be blocked, apart from the arteries. This can cause seizure at the onset. These are in short term, but in the long term, because of the stroke, there is a brain damage. So as a result of brain damage, there is a scar which is left behind. So as a result of a scar, this can cause sometimes seizure in long term. So stroke can be such as seizures in the short term or in the beginning of onset as a result of the stroke symptoms, and in long term as a result of scar epilepsy, where the scar is there and from which the electrical discharges start and cause seizures.
So what are the recommended annual tests that you would suggest for prevention or early detection of health issues? So basically what we can do in a simple way, every year you can have routine blood tests like blood counts, sugars, fasting and postprandial, and then you can check your vitamin B12, vitamin D levels. You check your kidney functions with the help of creatinine, urea, do the liver function test, do the lipid profile where you get to know about the cholesterol levels in your blood. And then just do a urine routine, do an ECG, have a cardiology opinion included because this is very important. ECG, echo, and a treadmill test and a cardiology opinion. And for men above 60 years, I think you should have a urology opinion to check for prostate-related issues and other. And then for women, you should have a yearly gynecology evaluation. So I think these would be the basic yearly health tests. Any advice for dialysis patients?
So for dialysis patients, first and foremost, they have a risk of stroke because of two things. One is that they can have blood pressure which fluctuates. The running blood pressure can be, usually we see that who are on dialysis, they usually have high blood pressure. So this per se predisposes them to risk of stroke, which can be either ischemic stroke and even hemorrhagic stroke also. And second thing is that doing dialysis and all, sometimes they are given certain blood thinners to prevent the blood flow from blocking. This can sometimes cause bleeding in the brain, which is there. So, basically, it is important that they follow the medicines prescribed by the nephrologist, and as far as possible, do the dialysis as suggested, and take other medicines like for blood pressure, etc., and control other risk factors like diabetes, dyslipidemia, and maintain adequate hydration to the extent that how much is recommended. So if they follow these basic precautions, the risk of stroke can be reduced.
And my high sensitivity CRP is 1.54. Is there any future cardiac risk?
So this basically, I mean, this depends on in what extent it was checked. Whether HSCRP is it's a blood entity which can be related to various reasons. One of the reasons is maybe a cardiac issue, but there are other reasons associated. So suppose you had a steady infection which is there, or any recent history of any COVID, etc., in the current era. So it all depends on what is the reason why it is elevated. So suggestion would be better to do a follow-up HSCRP after 2 weeks or something, or maybe you can just consult a cardiologist too. If you are above 40, you just get a basic ECG, echo, and treadmill done. If anything of that is normal, then it may be possible this, but based on this value alone, it's difficult to tell.
Yes.
Yes. So so I would like to thank Dr. Sowmya and Dr. Keni Ravish for this session, and Aster Hospital and Mayur for coordinating. And thank you everyone for taking out time and joining this session. These small things are very, very helpful. We all are runners and cyclists and all, but these type of sessions are very important, and we do not differentiate between heart attack and stroke and what is all this until we reach a hospital. So Aster has been trying their best that people do not reach the hospital. Is counterproductive, but that's why we have had sessions in past CPR session, this type of session. We'll be having some more, since some questions were for heart attack related. We'll be having some more session. But thanks a lot for taking out time, and thanks a lot again for your valuable time and agreeing to do this.
I would actually like to thank Dr. Sowmya and Dr. Keni. Actually, they have OPDs during this time, but somehow they agreed to come in the morning. Otherwise, we were planning a late evening session. So thanks a lot, doctors, for coming in, and thanks everybody for joining.
Yeah.
Thank you everyone. We really enjoyed. I hope this was useful for you.
Yes, ma'am.
Thank you.
Thank you, doctors. Yeah, it was very useful and informative. Thank you.
Thank you.
Thank you, doctor.
For this
Thank you,
wonderful
Gurleen.
session.